Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist in York Hospital, and today I wanted to do a quick video on the subject of blood pressure. I'm just running to work, so this is going to be quite a short video, but a lot of people have contacted me and they worry about their blood pressure, and they say, oh, my blood pressure is low. It measures, 90 over 60, and I'm terrified. What does it mean? How, and people seem to get fixated on their blood pressure, and they get fixated on the number. So I thought I'd try and see if I can alleviate some anxiety about low blood pressure in particular. The first thing to realize is that numbers don't really, numbers by themselves don't mean anything. They have to signify something, okay? So when you say my blood pressure is this, you have to understand that that number means something. It has to mean something. The second thing to say is that it is important to realize that blood pressure varies, okay? It varies within a person and it varies between people. It varies during the time of the day. It varies in populations. And there is always a range. There is no absolute number. The third thing to say is those people who say this is high blood pressure or this is low blood pressure go by some set of guidelines that have been produced by a bunch of doctors somewhere in a room who don't know you, the individual. So they are talking about populations, and they're talking about what it means to have blood pressures that range between certain values over several number of years. They're not referring to you, the individual, because they don't know you, the individual. So before you worry about a number, you have to understand what it means, okay? And basically what blood pressure is that the heart has to generate a certain amount of pressure with which the blood is expelled out of the heart so that the blood can go and supply the vital organs, okay? So the heart has to exert a certain amount of force which will then push the blood into the vital organs. For example, the heart is going to have to exert a degree of force to get the blood up to my brain, okay? It's not going to just sit there and just not, it's going to have to work to push it in. Similarly, the kidneys, the blood has to be pushed into the kidneys, and the amount of force that the heart is generating to do so is basically the blood pressure, all right? And it is important to realize that the only time a blood pressure is low, regardless of what the value is when the blood is not being exuded with so much force that it can perfuse the vital organs, okay? So if I have a blood pressure of 90, but I'm sitting here talking to you coherently, then that clearly means that the blood is getting to my brain. It doesn't really matter what my blood pressure is. The fact that I can speak coherently, the fact that I'm orientated in time and place and I'm not confused, means that the blood pressure, whatever the blood pressure is, it's enough to get the blood to my brain. If I am feeling warm to touch and if I am not pale and clapped out, then it means that the blood is going to my skin. If I'm able to urinate normally, then it means that the blood is going to my kidneys. So what I try and tell people is don't get fixated on the number. Ultimately, it's important to realize that if you in yourself feel well, then whatever your blood pressure is, it's not too low, all right? If you have low blood pressure, what will happen is you will get confused, you will not urinate, you will be cold and clammy to touch, you will feel extremely dizzy, all right? If you're ever worried that your low blood pressure may be causing you symptoms and you're not sure, the first sign of the low blood pressure affecting a person is when you change posture. So a lot of people, particularly people who are on blood pressure lowering medication will say, as soon as I stand up or as soon as I sit up, I feel dizzy. Now that's their blood pressure getting a little bit low, but they're taking tablets to lower the blood pressure, and that's why the blood pressure is low. So for example, when I see a patient, say a patient is bleeding, for example, okay, and of course you worry. The big problem with bleeding is that at some point there's not going to be enough blood for the heart to be able to exert enough force with to be able to push it into the vital organs. So that's called shock. Okay, having low blood pressure, which is not perfusing the vital organs, the brain, the skin, the kidneys, the stomach, if and the heart itself, of course, if the heart is not able to exert that much force, then that's a condition called shock. And some people who bleed, for example, they can become shocked because they lose so much blood that even though the heart is working really hard, there's just not enough blood to go around, and that is a hypovolemic or a hemorrhagic shock. And one of the first signs is if you stand up, if you change posture and you drop your blood pressure and you become extremely dizzy. But if you're not getting any of those symptoms, then please don't worry about how low your blood pressure is. In fact, low is better than high. So I always encourage people not to worry about numbers. You have to understand what those numbers mean before you start worrying. Okay, so I hope this was helpful. Now I just wanted to introduce Bluebell again. Bluebell Gupta, the new member of your cardiology team, where she's grown up since my last anxiety video. Let me take her here, and I thought we'd introduce her again. Here she is. Look at how big she's become. She's a bit dozy. She's a bit dozy. Hang on, Bluebell. Look at how big she's become. My darling. All right. Okay, so all the best. And this was a really short video, but I hope it'll relieve some anxiety about blood pressure. Okay, so remember, you can contact me if you like on this number, or you can actually come to my website. Sorry, oh God, I've got this wrong. It's www.yorkcardiology.co.uk. I'm sorry, I don't know why it's saying this. And then, and that's it. So, and you can also get in touch with me on Facebook, I hope. Oh God, this is awful. York Cardiology, Y-O-R-K, Cardiology. Great. Take care, all the best.